All right, our daily Corona stats from Johns Hopkins. As of 5:30 a.m. Central Time, total confirmed cases now worldwide up 110,617. That's a jump of over 10,000 people from Friday. Total confirmed deaths, 3,831. That is up from 3,400 since Friday. 62,000 patients have recovered from COVID-19 around the world. 109 countries now have confirmed cases. It was 94 on Friday. 4 more have suspected cases. 13 confirmed cases are considered serious. This is really good news. It was hovering at about 19% are serious cases for a very, very long time. And serious case is requiring hospitalization, and 4% of serious requires ICU. As of today, that number, which was for a long time 19 on Friday, down to 16%. Today, the number of confirmed cases that are serious is 13%. This is showing that as we find more and more cases, we realize, there's a lot of people walking around with this that are not real serious. It's the only ones that we were finding were the ones that are like, I can't breathe. Confirmed cases now in the United States, 27, with 6 more tracking suspected cases. Now, 27, that includes the one from CPAC. CPAC, somebody went, apparently had coronavirus, didn't know that they had it. Anybody who's gone there, I've heard from this weekend, are you okay? Are you freaking out? Because no, I'm not freaking out. Well, Ted Cruz self-quarantined. Well, he met with the guy. So did Paul Gosar. And then so did Matt Schlapp. Well, I shook their hands while I was there. So do I have it? Now, more cases are going to be found, and this is a good thing. Italy now has closed down 16 provinces, including Milan and Venice. Travel in and out, as well as within the area, is only possible now in response to duly verified professional requirements, emergency situations, or for health reasons. So they have taken half the population of Italy and locked them in their houses or their neighborhoods and said, you're not leaving. If you need to leave, contact an authority. Do we get there? Places of worship remain open, provided that a safety distance of at least 1 meter is respected, but religious ceremonies, marriage, baptism, prohibited now until further notice in Italy. People with symptoms of respiratory disease and a fever of 101 Fahrenheit or above are strongly encouraged to stay home and limit social contact as much as possible, including with their doctor. They're telling the people in Italy now, avoid all gatherings, if at all possible. All schools and universities are now closed in Italy. All museums and places of culture closed. All cultural, religious, or festive events suspended. Movies, bars, pubs, theaters, dance schools, game rooms, casinos, nightclubs, and all other similar places are closed. All sporting events and competitions are suspended. Ski resorts closed. Swimming pools, sports halls, thermal baths, cultural centers, gyms, wellness centers, all closed. Bars and restaurants can remain open from 8 a.m. to 6 p.m., provided they respect a safety distance of at least 1 meter between customers. This provision concerns all other commercial activities. So how do you go into a restaurant? They slide it like on one of those pizza things, they put the pizza in the oven. Is that how they slide your food to you now? There is a doctor that authored the CDC's pandemic response strategy, calls COVID-19 the most frightening thing he has ever seen. This is a guy that worked on Ebola, MERS, and SARS. He said it is frightening because the combination of infectiousness and the lethality that appears to be many-fold higher than the flu. He said there were just 3 cases in Italy 2 weeks ago. There are now over 7,000. He said, I don't think it's a crazy analogy to compare this to World War II. The World Health Organization is using these kinds of terms. They've seen what this virus is capable of doing. Dr. Hatchett, who's author of this, joined other epidemiologists in warning not to compare COVID-19 to the seasonal flu. He says it's at least 2 or 3 times more infectious and at least 10 times as deadly. He says there's no comparison. Now, I don't know if you've seen this, but they're now saying over in England that this guy is just trying to scare everybody. He scare you, Stu?
No, I don't think so. No. Should I be scared?
Nope.
I don't think so. I mean, look, go back to the CPAC thing you were talking about. We were both there, right? You
spend more time there.
Ted Cruz was there. He's self-quarantining. He hosts a podcast with Michael Knowles, who I had on the show in the same room with me for an hour. Right after they did the podcast live at CPAC.
With Ted Cruz.
It is an interesting thing because I certainly understand why they're not telling us who the person is or people are who have it at CPAC, because probably people would go to their house with torches and I have no idea what would happen.
Why?
I don't know. I don't know.
They didn't know.
But I mean, I know they didn't do anything wrong, but I mean, there is your life is turned upside down, right? You're going to have media requests from everywhere. If they release this person's name, I certainly understand if I was that person, and I'm not saying that I am, but if I was that person, I would want my identity to be kept quiet if at all possible, because it would make my life a nightmare.
That makes me think he is that person.
I have an announcement coming up on Stu Does America tonight. Tune in. I'll just say this. Not feeling well. Was at CPAC. Hung out with Michael
You haven't
Knowles.
been feeling well.
That's true.
You haven't been feeling well.
I have not been feeling well.
I haven't been feeling well. Pat hasn't been feeling well.
Yes.
None of us have COVID-19. I don't think.
We don't think.
We don't
right.
think.
Now, it takes a couple of weeks for you to get past the time where you could go without symptoms. It's only been like 10 days or something like that since we were at CPAC. But it is interesting that, Ted Cruz knows who this person is. And Ted Cruz knows, which is great for Ted.
Thanks a lot, Ted.
Did I interact with this person? I don't know. No one told me I did or did not.
Well, I
don't know.
I interacted as you did with people who did interact with him.
Absolutely.
So
that is for sure.
Right. Congratulations.
So basically,
we're the big winner.
Yeah. And I keep looking at this as, I've read enough about it. I've looked at this. I don't fear the disease itself.
No.
I kind of assume I will get it. And if I don't get it this year, as you pointed out, this is going to stick around.
We're all going to get it.
Right. The flu stuck around, right? The Spanish flu has stuck around.
Yeah. It's just the problem is there's no vaccine, where there's a vaccine right now which helps old people, live through the average flu. So if you get it now, there's no vaccine. There appears to be some things that are working on it.
Some of the
AIDS,
HIV medication.
Yeah, some of the AIDS medicine is actually helping cure this. But we're all going to get this. It's only a matter of time, and we're not all going to die.
Right. If the flu did not have a vaccine and did not have 4 approved treatments for it, the death rate would be a hell of a lot higher than 0.1%. Part of the reason why it is a 0.1% is because of the way we've reacted to it. We've seen this happen as well with South Korea, who's been aggressive, has a good health system, has been aggressive trying to contain it, is reporting a 0.5% mortality rate, as opposed to 2 and 3 in other parts of the world.
So let me give you a couple of other things here. We're going to debunk the coronavirus myths for you in a second, but I want to give you a couple of last stats that you need to keep in mind. U.S. case count expected to spike dramatically this week. Why? Because we are now starting large-scale testing all across the country. In January, doctors at the CDC decided to reject the WHO standards for coronavirus testing, noting that 30% false negative was found in China. Now, Donald Trump, he didn't do enough. They should have accepted it. It was a 30% false negative. And so the United States CDC, not directly getting a phone call, I'm sure, from the president saying, reject that. They looked at that and said, that's too high of a false negative. and a false positive. So, no, we'll come up with our own. The tests produced by the CDC in early February were designed to test for SARS-CoV-2, the virus that causes COVID-19, as well as SARS-CoV-1. Ugh. But they were faulty and had to be replaced because Donald Trump told them, I'm telling you, put carrots in that formula.
Yep, he's a big carrot proponent.
Big.
But that you can't inject a carrot. He should have known that.
He should have known that.
It's very difficult
It's just
to do.
his incompetence that makes it. Anyway, by today, more than 2.2 million new tests will have been sent out to the regional labs and the hospitals, according to the U.S. Surgeon General. Large-scale testing is expected to dramatically increase the case count in the U.S. Right now, suspected 1,200 cases in 33 states. But we don't know. When you see a huge spike this week, it's because we're testing now for the first time. I want to talk to you a little bit about Farr's Law. I didn't even know what Farr's Law was, but I knew of it, and all of us at some point knew what Farr's Law is. It was actually named after Dr. William Farr, 1840, and there is a bell curve pattern to it, and almost all epidemics follow this pattern, including a sharp increase in cases at the beginning of the cycle, and then the peak, and then it comes down and returns to a baseline. This pattern exists because we modify our behavior so we don't get sick. And those who do get sick, they seek medical attention. China, which had its first cases in December, peaked in last January or early February and is now in decline of the spread phase because they modified their behavior, which is what we're doing. We are about 45 to 50 days behind where China sits. So we are still now at the early stage of the up of the bell curve. In 45 or 50 days, we will start seeing the down just like everybody else. It's not getting worse. It's just our turn now. And it indicates that our peak cases should be in April or early May and then decline through June and July. I'm still looking for an answer that I'm comfortable with on whether or not this is a seasonal flu or not. We're not sure. Normally, flus have a season, and when you get into hot weather, it starts to dissipate. Korea is expanding and going through the roof. Well, they found that Singapore, which is much warmer and more humid, is actually not growing at the same rate. So they think there's a possibility that this is a seasonal flu, which would be a very big blessing to the world. Unfortunately, not for Australia and New Zealand. They already have cases, which is odd if it is a seasonal flu, but they're also closest to China. And so things would be getting worse on that hemisphere as things get better for us. And the world could catch its breath from this as we move towards a vaccine.